Medical imaging has come a long way since 1895, when the X-ray revolutionised diagnostic techniques. Today's technology offers unprecedented opportunities to see deep within the human body. And when clinicians and researchers join forces, the potential for discovery is boundless.
At the University of Queensland, we're developing molecules which allow the detection of diseased tissue. Those same molecules allow us to deliver a drug to specific parts of the body. To judge the effectiveness of this treatment, we need to be able to see the cure, so to speak. And not far from here, we have a facility which allows us to do just that.
At QUT, we're interested in understanding how the body works, in disease and recovery. To do that, we have to image the body. And just down the road, we have a facility that allows us to do just that.
At the QIMR Berghofer Medical Research Institute, we're exploring ways to diagnose mental health disorders before the symptoms appear. To do this, we need to develop new diagnostic tests using medical imaging technology. And just around the corner is the facility that will allow us to do just that.
Here at the Royal Brisbane and Women's Hospital, we are absolutely committed to better understanding the conditions and diseases that our patients have, with a view to offering them the best possible treatment. We want to push the boundaries of our understanding, and by forming strong teams between the lab and the clinic, and right here on this campus, the Herston Imaging Research Facility will help us to achieve just that.
HIRF is one of the most exciting imaging ventures of all Asia Pacific. Siemens has equipped this facility with the latest imaging technology, including MRI, PET-CT and PET-MRI. However, Siemens' involvement doesn't end there. Siemens is also providing clinical expertise, which will help develop new technologies and groundbreaking results.
Theranostics describes the combination of diagnosis and therapy of a disease. And here at the University of Queensland, we're developing new molecules and nanoparticles which combine those two functions into a single entity. The combination of the MR scan and the PET scan allows us to obtain functional information from the PET scan with the exquisite anatomical information which we acquire from the MR scan. This additional level of information gives the clinician much more confidence of effective therapy.
Having everybody in the room, from laboratory through to clinician, all focused on imaging, allows the exploration of questions that we would never have otherwise contemplated. And the clear view and the clear requirement for those teams is to propose research that is going to have either a clear benefit in terms of our knowledge and understanding of disease, or indeed in terms of reducing the morbidity of treatment by being far more highly selective.
There's absolutely no laboratory or imaging tests for mental health, or for any mental health disorder. In the rest of medicine, we have laboratory and imaging tests, and the actual diagnostic categories are based on what those tests have told us about the underlying pathology. So when we have imaging facilities like HIRF, we can begin to categorise and discover different subtypes of mental health disorders. So an imaging test would allow doctors and patients to have objective follow-up. It's exactly what we're doing in medicine that we're not yet doing in mental health and psychiatry.
QUT will be exploring MRI and PET, two different imaging modalities, to understand structure, function and disease such as cancer and stroke. With this imaging technology, we can detect, we can monitor progress, and we can see whether or not we can predict recovery. Having state-of-the-art imaging technology and the best research with our partners will ensure that we can train our students in the areas of medical imaging and radiation therapy to produce the best professionals for the future.